So starting off, I would like to discuss the iliopsoas muscle group. This consists of the iliacus muscle and the psoas major muscle. The iliacus originates on the iliac fossa and inserts on the lesser trochanter. The psoas major originates on the anterior and lateral surfaces of T12 through L5 and inserts on the lesser trochanter, and that also helps with hip flexion. I'd like to point out the psoas minor as well. This is not part of the iliopsoas muscle group, but this also assists in hip flexion. It's a more weaker flexor of the trunk. So all three of these muscles help with hip flexion. Moving forward, I would like to point out this is the gluteus maximus, which originates on the posterior sacrum and ilium and inserts on the posterior femur distal to the greater trochanter and to the iliotibial band. So this helps with hip extension, hyperextension, and lateral rotation. Right here we have the gluteus medius, which originates on the outer surface of the ilium and inserts on the lateral surface of the greater trochanter. This helps with hip abduction. Now we see the gluteus minimus. This originates on the lateral surface of the ilium and inserts on the anterior surface of the greater trochanter. It helps with hip abduction and medial rotation. I'd like to show a more external view of the gluteus, including the tensor fasciae latae. So this is the gluteus maximus, gluteus medius, and the tensor fasciae latae, which originates on the ASIS and inserts on the lateral condyle of the tibia. This helps with hip flexion and abduction. Now I would like to discuss the P-go-go-Q muscles. So we have the piriformis, the superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. We will notice that the obturator externus is not able to be seen from this view, so we will need to dig deeper. So let's remove that. And there we have it, right there. We have the obturator externus. So all of these muscles that I had just mentioned and removed help with lateral rotation. Take a look at the pelvic floor muscles. So up here we have the
coccygeus,
and over here we have the
iliococcygeus,
and right here,
pubococcygeus,
and same with that,
pubococcygeus,
and this muscle,
puborectalis, puborectalis,
and this is
detrusor, detrusor, detrusor.
This is the sartorius, which originates on the ASIS and inserts on the proximal medial aspect of the tibia. The action is a combo of flexion, abduction, and lateral rotation. This is the rectus femoris. The origin is on the AIIS, which is the anterior inferior iliac spine, and it inserts on the tibia tuberosity. The action is hip flexion and knee extension. This is vastus medialis, which originates on the linea aspera and inserts on the tibial tuberosity through the patella tendon. The action is knee extension. This is the vastus lateralis. It originates on the linea aspera, inserts on the tibial tuberosity through a patella tendon, and the action is knee extension. We will need to remove the rectus femoris. This is the vastus intermedius. It originates on the anterior femur and inserts on the tibial tuberosity through the patella tendon, and the action is knee extension. So here we have the biceps femoris long head. It originates on the ischiotuberosity and inserts on the fibula head. The action is hip extension and knee flexion. Here is the biceps femoris short head, which originates on the lateral lip of the linea aspera and inserts on the fibula head. Now, here is the semitendinosus, which originates on the ischiotuberosity and inserts on the anterior-medial surface of proximal tibia. The action is hip extension and knee flexion. Now we have the semimembranosus, which originates on the ischiotuberosity and inserts on the posterior surface of medial condyle of tibia. The action is hip extension and knee flexion. Rectus femoris, vastus medialis, vastus lateralis, sartorius, that's also vastus lateralis, biceps femoris long head, biceps femoris short head, semitendinosus, semimembranosus, adductor magnus. Okay, we're going to stop right there and we're going to now dig a little bit deeper and we will review those other adductor muscles now. So I would like to remove all of the muscles that we had previously gone through. And there is the sartorius, the vastus medialis, rectus femoris, vastus intermedius, and that's the tensor fascia lata. There's the psoas major, psoas minor, iliacus. Oh right, and that is the gluteus minimus, the gluteus maximus, the gluteus medius, gluteus minimus, piriformis, superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. And don't forget the obturator externus. Alright, so now I'm going to kind of just go ahead and review the muscles that we have not done yet. So we are going to look first at the pectineus. So this originates on the superior ramus of pubis and inserts on the pectineal line of femur. The action is hip flexion and adduction. This is the adductor brevis, which originates on the pubis and inserts on the pectineal line and proximal linea aspera. This also helps with hip adduction. This is adductor longus. It originates on the pubis, inserts on the middle third of the linea aspera, and helps with hip adduction. Now here we have the adductor magnus. It originates on the ischium and pubis and inserts on the entire linea aspera and adductor tubercle. Okay, and then it helps with hip adduction. And now here is the gracilis, which originates on the pubis, inserts on the anterior medial surface of proximal end of tibia, and also helps with hip adduction. So as you can see, all of these muscles that are near the medial aspect of the body, it will help with hip adduction because these muscles are involved when you are bringing your leg back to the normal, the normal position. So just remember, wherever the muscles are, it kind of helps with what the action does. Also wanted to show a posterior view of these muscles. So if we turn this around, we see that is the adductor magnus, and we have the pectineus there, and we can see the adductor brevis there, and also there's the gracilis. A quick review: we have the pectineus, adductor brevis, adductor longus, adductor magnus, and gracilis.